Hello, my name is Chris, and I'm a registered nurse. I'm one of the nursing supervisors with the Nurse Triage Department here at CorVel. We all know that the world is facing an unprecedented challenge with this new virus referred to as a coronavirus or COVID-19. There are many types of human coronaviruses, including some that commonly cause mild upper respiratory illnesses. The COVID-19 is a new disease caused by a novel or new coronavirus that has not been previously seen in humans and is rapidly spreading. Thankfully, what we do know is that we still have opportunities to take systematic measures that can help you protect yourself, your coworkers, and your family. We would like to share some of the same valuable information that our CorVel nurses are providing, which is based on the CDC guidelines. We hope that this information will help to alleviate some confusion, as well as provide important guidance if you should develop symptoms. The best way to prevent illness is to avoid being exposed to this virus. What can you do for prevention? Wash your hands often with soap and water for at least 20 seconds, especially after you have been in a public place or after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use a hand sanitizer that contains at least 60% alcohol. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Avoid unnecessary travel plans. Clean and disinfect frequently touched surfaces daily. And the CDC does not advise wearing a face mask if you do not have symptoms. So what does an exposure mean? If you have been in close contact or within 6 feet for a prolonged period with someone you believe has COVID-19 symptoms or has been confirmed to have COVID-19, then you may have been exposed. If you have had direct contact with infectious secretions of a COVID-19 person, even coughed or sneezed on, then you may have been exposed. If you have experienced either of these scenarios, contact your primary care physician or local health department for medical advice to determine whether you need to seek medical care. So what are some of the symptoms? Symptoms can range from mild to severe. If you develop symptoms, notify your primary care physician or local health department before proceeding to a healthcare facility. Allow the provider to screen your symptoms and determine if you need to be seen or just receive other advice. Pre-existing conditions such as heart disease, diabetes, and immunocompromised conditions can put you at greater risk. Some of the main symptoms are fever, cough, and shortness of breath. Some possible additional symptoms may be body aches, sore throat, nausea, vomiting, or diarrhea. However, if you develop any of the following symptoms, get medical attention immediately. Emergency warning symptoms include severe difficulty breathing or shortness of breath, extreme weakness, persistent pain or pressure in the chest, new confusion or inability to arouse, bluish lips or face. CorVel continues to work diligently to meet the needs of our customers and is taking action to implement strategies for the reporting and managing of work-related coronavirus exposures. Helping to educate your employees can alleviate fears and provide guidance while minimizing unnecessary burdens on the healthcare system. CorVel Advocacy 24/7 triage nurses are following CDC guidelines when triaging workers, but will not be advising a worker to stay home from work since only a medical provider or employer guideline can make that decision. And finally, we encourage you to utilize reliable health information sources, such as the World Health Organization, Centers for Disease Control, or the United States Department of Labor. If you are still concerned about symptoms you or a family member are exhibiting, please contact your medical provider. For more information about how CorVel can help, please contact your account manager. And please continue to take the necessary precautions to help prevent the spread of the coronavirus. Together, we can keep our communities healthy, For more information and updates on CorVel's response to COVID-19, visit www.corvel.com.